general examination include too many things. First, this general examination will start since you start history. Actually, when you see the patient coming in and talking to him, you are going to start physical examination. You see the way the patient talk, the expression and the complexion of the patient, and the way he moves and he talk. All these actually is part of physical examination, and there is nothing like you take history alone and then you start physical examination. They come together. When you start your history, you're starting physical examination. And one of these important physical examination is the cyanosis. Before we discuss this important topic, I think we better know again basic knowledge of physiology, basic knowledge of anatomy, because without this we cannot understand and we cannot explain these findings. Now, what is cyanosis? I don't like you to just listen. This is not a formal lecture. I'd like this to be an interactive. We call it interactive lecture. I mean, you share in the discussion. You share in the lecture. I mean, you are an important part in the lecture. Okay? So, what do you think? What is cyanosis?
It's a blue discoloration of the skin and mucous membrane because of increased level of reduced hemoglobin in the blood and reduced oxygen tension. It's divided into central and peripheral cyanosis. Below the level of 90, the
oxygen saturation,
auto saturation, the cyanosis will develop. This is roughly speaking.
Below
when oxyhemoglobin يعني أكثر من 5 أو 50 reduction.
Now this does not hold true with all cyanosis if you talk about reduced hemoglobin.
Yes.
Hemoglobin by 5%.
Yes.
Or more than 5%. Actually does not include something like anemia. A person with anemia cannot show this. I mean, despite cyanosis,
difficult to develop anemia patient.
Exactly. But if you take the definition, it depends actually on the saturation. Now, what is the level above and below that produce cyanosis? Oxygen saturation.
90. Below 90.
Below 90 it will develop.
90, never. The patient is not having. Below 87.
Yeah.
87. Anything below 87, the patient will show cyanosis.
Yes.
Anything above 87, the patient wouldn't show cyanosis. We should differentiate between two things. Between hypoxia and saturation. Now, what is the significance of cyanosis clinical? What does it mean? If you see somebody who is cyanosed, what does this mean for you? The patient is cyanosed. What does this mean?
The central cyanosis is the serious.
No. We are talking about cyanosis in general. What does this mean? If you hear something like cyanosis, what does this mean?
There is low oxygen saturation in the tissue.
Yeah.
Hypoxia.
So the hallmark of cyanosis is hypoxia. So if you see somebody who is cyanosed, it means that the person is hypoxic. But not every hypoxic would be cyanosed. Say a person having asthma, too much tight, but because asthmatic, an acute asthmatic attack, they do have what is called hyperventilation, something like that. So because of low obstruction and interference with the oxygenation of blood, but because of tachypnea, it would compensate. Because the total alveolar ventilation would be adequate. So the patient saturation, say 90 or 92, the patient wouldn't show cyanosis despite hypoxia. So, but if the level is, if the saturation is coming down below 87, then the patient would show cyanosis clinically. Not through arterial blood gases. So clinically, if you see somebody who's cyanosed, it means that the patient is hypoxic. But a person who's not cyanosed clinically does not mean that the patient is not hypoxic. حتى نفرق بين الشغلتين. Okay, clear?
Yes.
Now, let's see why the person develops cyanosis. Because of low oxygen saturation. Saturation of what? We are talking about basic physiological fact.
Saturation of hemoglobin.
Hemoglobin molecule. Because oxygen is carried not in the solution like carbon dioxide, it is carried within the hemoglobin molecule. Just think that hemoglobin molecule is like a bucket in a supply. If you fill it more than, it would spill out. So it doesn't help. I mean, once it is saturated, the hemoglobin molecule is well saturated, you cannot add any more. Okay? You
Yes.
cannot add any more. So oxygen saturation is saturation of hemoglobin molecule. Now, why the patient is showing cyanosis? Because there is a disturbance in the process of oxygenation. I mean, this hemoglobin molecule is not well oxygenated, so the saturation is low. Clinically, when you see somebody who's cyanosed, it is either central or peripheral cyanosis. Okay? Now, what is central? What is peripheral? You tell me.
Central because of low cardiac output, and because from the heart, and peripheral there is local cause, vasoconstriction or so on.
It's a good kind of explanation, but it doesn't fill actually. Why we call it central? Because it is the center of oxygenation of the hemoglobin molecule is affected. Let's ask ourselves, what is the center of oxygenation?
So within the brain,
Center of oxygenation.
Lung الهارت.
Within the
Heart.
heart cage.
Lung and heart.
So, what is this center of oxygenation? Center of oxygenation. شنو center of oxygenation؟ يعني let's talk about the physiology. To have a proper respiration, you need 3 elements, important elements. First, proper ventilation, which is bringing air from the external environment to the lung tissue. Okay, so you're bringing, now that these are air spaces, you have to bring air through ventilation. You have to bring the blood to the air spaces. Again, blood and air. And the third important process is the exchange of gases between the air phase and the blood phase. Okay? This is the whole mark of center of oxygenation. So the alveolus is the center when you bring blood and you bring air. Proper aeration, proper ventilation, and a proper perfusion and the proper exchange of gases would produce a good oxygenation of the hemoglobin molecule. Okay? Now, any problem happened in these three important elements would interfere with the center of oxygenation, and the patient will develop central cyanosis, either from the ventilation, from the perfusion, or the exchange of gases. All these three would produce central cyanosis because it is within the center of oxygenation, which is the illness. Okay? Clear as?
Yes.
هسه فهمنا شو بس. Peripheral, by its name, it's away from the center of oxygenation. If it is within the center, we call it central. Away from the center of oxygenation, we call it peripheral cyanosis. As simple as this. خلي نفهمها بهذا البساطة. Okay? Now, if the patient is having, now we know what's central, what's peripheral. Why we choose the tongue for examination of central cyanosis? هذا common sense.
هوت سايت هو اولا يكون يعني هوت ما معرض للبروده يعني كلش.
Protected from external environment.
Because all of us, we have already experienced some kind of peripheral cyanosis because of the direct.
Cold.
You know, this is simple physical fact. Cold weather or exposure to cold would cause vasoconstriction. This is the effect of the cold to the arterial system. Vasospasm. Warmth would cause the other way around. It would cause vasodilatation. Okay? Clear?
Yes.
Now, we know basic knowledge of anatomy and physiology. We know the heart is a pump. Left ventricle is going to pump blood to the circulation and then come back. There is another a process of respiration. سميناها شنو? Tissue respiration. Tissue respiration. Again, there is a problem here. So we have to think about peripheral and central respiration. Peripheral or tissue respiration. Okay? هذا عرفنا when we check for central يعني peripheral واحد يمكن بالبرد شايفين ناس شوف الخشمة مزرق داناتها مزرقة شفايفها مزرق these are what?
peripheral.
ما له علاقة بالألبس peripheral cyanosis because the person is exposed to cold. كل واحد حتى بالصيف شيل له واحد ثلجاية خليه بإيده.
السلام عليكم.
السلام.
محاضرة علمية لو
نعم.
إدارية.
لا عن ياسر.
عندنا هسه مبدئيا مالك بس اخذ الجدول بس مبدئيا اخذ مال سالم بس
خلي الجدول يعني يا واحدة 20 مرة يقول لي انت بدي اسجل انت.
Now, we are coming to now the step, the practical approach to the examination of cyanosis. How would you approach a patient with cyanosis? You're going to do the following point. First, أول شيء سوي.
شوف cyanosis peripheral أو central cyanosis.
أول عمل تسويه you hold the hand.
Hold. Yes.
You catch the hand.
Cold or hot.
You see, is it cyanosed or not? First step. Second,
So moist hand or cold hand or cold.
Cold or hot.
you catch it. Next step, you see and then you catch. If it is cold,
Peripheral.
if it is hot, it's definitely central.
Central.
If it is not hot or cold, again, this is central. Okay?
Yes.
Except in one condition, ممكن يصير عندنا not central. When there is any malformation, يعني shunting. Say like shunt from the radial artery to the veins.
Local يصير.
Local.
Yes.
فيصير shunting local ممكن يسوي لنا هذا. هذا نعرفه. Unusual. راح نحكي على common kind of presentation of cyanosis. Now, so first you look to the hand, you see is it cyanosed or not, and then you catch the hand. Is it normal? Is it hot? Is it cold? Provided that your hand is normal. If your hand is cold, everything would be hot, and the other way around. هسه هتسألوا نفسكم سؤال على second your patient. Your patient is having either one of two things. Either this is a pure left ventricular failure or biventricular failure.
Yes.
هنا بيجي بعد ما الساينوزيس وقف ما يقدر يفرق بينهم. لازم نعتمد على شغلات أخرى. شنو الأشياء اللي نعتمد عليها حتى نفرق. Well, this patient is having either both left and right ventricle is affected or pure left ventricular failure. الاثنين would show the same kind of presentation in this way. نفس الطريقة ما تختلف.
signs مع right ventricular failure الأديمة والجي
JVV.
If you see these signs, other additional signs, ذاك الوقت هنا أنا شو راح تفحص؟ basically شوف عندك
Basal crepitation.
apical gallop, basal crypts.
We are left.
Okay, طبعا. If you see other evidence of right side ventricular venous pressure is elevated, ankle swelling, and hepatic congestions, maybe ascites, the patients have biventricular failure. Clear? هسه شو؟
Yes.
نجي دورك. ما يقدر ياخذ. You examine the hand.
Cold.
It is not cold. It is hot. شو تقول عليه؟ أول قبل ما يكومنت يعني تسترسل أنت رأسا بالك شو يعتبر؟
يعني هو شو هل هي سيانوست أو نوت؟
The hand is cyanosed and hot.
And hot. يعني it's been
No, center.
سنترال لازم سنترال ما مقبولة لأنه أنت هنا there is good amount of blood coming because the hand is hot. That means there is dilatation. There is nothing like poor circulation. There's good amount of circulation. Okay. Pulse is rapid again, but large volume pulse.
We look for the tongue.
Tongue is cyanosed. تأكدت أنت من الأول قلت هذا central cyanosis صعدت فوق أكدت هذا الموضوع إنه your patient is having central cyanosis.
Yes.
What's the condition that fit with this diagnosis?
Shunt. There must be shunt. IV fistula.
oxygenation
Shunt. What's the cause of
قصدي right to left shunt قصدي هيك
Right.
VSD
right to left shunt. Right to left shunt.
بس هي pulmonary
راح اقول لك ثلاث شيء. هو اللي ممكن نسوي لنا هالاشياء بس اقول واحده ناقصه. اول شيء the hand is not hot. It is normal. لا cold ولا hot. Normal. يعني تخلي ايدك مثل normal. It is not cold. It is not hot. What causes the hotness? احنا سجي حكينا قبل.
CO2 retention.
عندنا vasoconstriction. زين اللي هنا لا ما دام hot there should be vasodilatation. Now we look back. What is the causes of vasodilatation? And this is specification.
كان مثلا check blood pressure لو بس
ما تحتاج. انت هنا تفكر what is the condition that causes vasodilatation?
ممكن sepsis أو acidosis.
Acidosis vasodilatation.
CO2 retention
Chronic obstructive
is the
pulmonary disease.
vasodilator. Strongest vasodilator.
Chronic
Patient with
bronchitis.
COPD. هذا بيمنعش. Patient with COPD will have large bounded حتى قسم منهم يصير hyperdynamic circulation. As features of corporal.
Yes.
Hyperdynamic circulation because of vasodilatation. Vasodilatation causes a process. So there is hypoxia and hypercapnia.
Hypercapnia.
أي حالة يسوي لنا هذا؟
COPD.
صح ولا لا؟ يعني it is a respiratory problem that causes this. It's not cardiac. This is a respiratory problem that causes hypoventilation, causing both hypoxia and hypercapnia. ما هو
استاذ بالهسه بالكتب هاي بالجديد ما كان عندهم معطوا لك سنترال سيانوسيس لازم اكو شانتين بس هم من ضمنها يضيفون انه هذا يعتبروا انترا بالمونري شانتين بالمونري اديما
يعني دي
سي او بي دي يعتبر انه البلاد يفوت باللنج without يعني keeping in touch without يسموه شانتين.
The pathophysiology of what is ventilation perfusion mismatching as it's called. يعني هذا الفنتليشن perfusion هذا مو هو قديم مو جديد. ماكو شيء اسمه جديد. من زمان معروف انه there is always some kind of ventilation perfusion mismatching. Even normally the upper zones are actually well ventilated and less perfused, and the lower zone of the lung is well perfused and less ventilated. But this should not affect, should not affect the functions of respiration or the act of respiration. But if the patient is having a problem, like يا إما عندك physiological shunt or physiological dead space, this will create this kind of اللي حكينا عن center of oxygenation, which is not our matter. مو موضوعنا نحكي physiology of ventilation perfusion mismatching. زين؟ كلير هسه؟
Yes.
إذا شخصنا حالة أخرى. اجى دورك. خليت الحال
ساينوست موتور
كول.
تمام
يعني شنو؟ يعني شنو؟
يعني peripheral.
When the hand is cold
peripheral.
ما تتحمل شيء آخر. قلنا له hot تتحمل سنتر. هذا this is definitely peripheral. فهمت شلون؟ ليس تقول سنتر.
مو تيجي تسطوني في كيس انه هذا
بس hot. أنت مو قلت cyanosis and you touch the hand is cold. This is definitely peripheral. إذا رجعنا هذا ما نسوي هذا شيء. يعني معناتها عنده فيزوال دالتيشن إذا عنده سنتر.
اول كيس اللي كان لو كاردياك اوتبوتهم كان كولد.
إيه.
ذاك peripheral لا.
هذا اثنيناتهم عنده سنتر والبريفرال.
اكو واحد.
ما له علاقة. نحكي على حالتين. هذا peripheral cyanosis. If it is cold, this is peripheral cyanosis full stop. خلاص انتهى الموضوع. لازم تفتش إذا هذا المريض عنده بعد شيء وراها. شو السبب؟
تمام.
إذا يجي وراها شو السبب؟
pulse.
Pulse normal ماكو شيء. خلي ايدك على البلس normal. يعني ما بي لا rapid. أهم شيء it is not rapid. Maybe if the problem maybe you feel that the pulse is not very much obvious on the hand. شو نسميها؟ هسه صار عندنا الريت normal. يا اما normal pulse يا اما the pulse is weak on the بالحالة and the two would have the same kind of ما تريد بعد تفحص؟ اي وقفنا عندنا البلس
تونج
لا ماكو ساينس. هذا شو معناته؟
peripheral sinus.
pure peripheral sinus pure peripheral sinus full stop. زين شو اللي هذا احنا اول حاله مالتك همين كان عندك pure peripheral sinus بس اكو شيء يختلف. هذا دي pulse and rapid احنا عندنا pulse rate normal.
ماكو sympathetic ولا كليت.
يعني معناتها ماكو cardiac output is not affected here. Otherwise sympathetic overstimulation would cause tachycardia. مو صحيح؟ إذا شنو هذا الحال؟
Lot of obstruction to the arterial flow.
normal.
local problem. local in the upper limb. هذا بيجي حالة ممكن you may see unilateral. If it is bilateral يعني on both sides الرينود. بس إذا جتنا unilateral only on this side, the other side is normal. pulse يختلف هذا يختلف بس هذا أي حالة ممكن نسمى مثلا cervical local problem here, tumor pressing on the artery, clot, arterial clot, trauma, كلها تسوينا نفس الشيء. اوكي؟ انت بعدين نرجع لي.
نعم. cyanosis.
cyanosis.
cold or hot.
neither cold nor hot.
pulse.
pulse normal.
normal. tongue.
tongue cyanosis.
most likely central cyanosis.
Yes. This definitely there's no peripheral cyanosis.
Yes.
هذا شو أكثر احتمال.
البلس كان نورمال عندنا يعني ممكن كاردياك يعني اكو فد اي في مال فورميشن او يعني فد كونجنتال هارت ديزيز ممكن
مثلا
يعني ممكن اذا ساينوتيك هارت ديزيز يعني في اس دي مثلا وذ انكريز
نفس الوقت
pulmonary
clubbing
yes
متبعوا على التم الاصبع انت اول ما تفحص مريضك physical examination تتبعوا على الهاندز and you look to the
clubbing
صحيح
yes
there is clubbing of fingers
like this congenital heart disease cyanotic
ولو انت راح الصعبه اللي راح تصير عليك
يساعد
بس راح نخليك انت يعني راح اعاونه لان احنا عرفنا ستبس هو عندك my hand you look to the hand the hand is cyanosed what's the next step قولوا له شو نسوي لازم
cold
cold or
normal
normal
cold ولا
finger
البلس
pulse let's call it hyperdynamic
yes
what large volume pulse
large volume
but normal هذا ما يعني not hot
not hot
tongue
tongue cyanosed
cyanosis finger على الساعد شيء مثلا كلابنج
شوية clubbing
شوية كلابنج
هي أقول clubbing بعد شو نشوف
فاللور لم نشوف اللور لم ممكن بقى نشوفها
عادة clubbing of fingers will be shown on the tip of the أكثر more than the fingers toes clubbing is more obvious than the if you suspect look to the nail of the toes
central cyanosis with normal
large volume
large volume
PDA ممكن PDA إذا صار ريفيرس يعني
إذا صار أزمنجر دخل بخانة left right left shunt
نعم
صليت هيموجلوبين
70% فورميشن امتحان
هيدي بس كلها بالجهتين هو يعني يرحم وين مريض ما فورميشنز بس لازم في المكانات عدة مكانات صايرة أي حالة يسوي لنا طبعا from the clinical setting أنا أحكي لكم فشي ثيوري بس في البراكتس راح عشان تساعدك the look of the patient once you look to the patient you give this diagnosis بس أنا we are talking about specifically the cyanosis as a sign for the sign of something and difficult diagnosis can be approached by just look to these steps simple steps يعني we may sometimes miss this but if you carefully concentrate having this background of your physiology your anatomy you can explain the findings يلا وصار الشنط صحيح صار الشنط حتى سوينا hyperdynamic circulation peripheral هذا shunting يسوي لنا hyperdynamic circulation. شو بيخلينا فد شيء يسوي لنا شنطي اوفر يعني
ماجد
هواي مكانات تصير حالات
هواي مكانات يعني
يمكن اذا سالوا بعض الاسئله اقول لكم شنو
عملية التكتس
يعني مريض انا شايفها بعيني بدنا نشوفها بس انا
مريض ديسنك ولا لا؟ مريض ديسنك
سنترال
liver disease he said.
yes very good.
Yes.
The patient is looking anemic and maybe jaundiced. Not necessarily all those, but the chronic liver disease. What is the problem in chronic liver disease that was hyperdynamic circulation?
Hepatopulmonary يصير يعني البلود يصير شنط بالبلود.
يعني
Portopulmonary.
احنا يعني كلينيكلي مدور عليها وهذا مثل هذا الصير because of
portal hypertension.
إذا تلاحظون what are the signs? اسمها signs of chronic liver disease. What are these signs? نشوفها. Signs of spinal شنو what are these spinal
أي ما فهمناش.
small results.
Exactly, telangiectasia. It's one form of telangiectasia, which is actually this telangiectasia actually does not fit with arteries. It is not pulsatile, but it's wall actually similar to artery, but there is no pulsation because it is not connected with the arterial system. But it connects the venous side to the arterial side. Now, say these telangiectasia are present all over the lung, in the lung, in the liver, everywhere, the muscles. These telangiectasia, when it become to a level that could interfere with the circulation, causing hyperdynamic circulation. And this shunting of blood from the venous side to the arterial side, hence the patient will show cyanosis. شوفوا واحد مزرق central cyanosis. شو يعني هي نتيجة على this sign of cyanosis. You have to put the too many other conditions that causes the cyanosis. Okay? Clear? أعتقد إحنا will cover most of the important topics in medicine that causes cyanosis, and we are able from just simple sign to establish a very difficult diagnosis. You need echo catheter to establish the diagnosis, but we are able to diagnose these conditions with reasonably confident to tell these diagnoses without much of hesitation if you keep these things in your mind. Let's stop at this point, and if you have any questions regarding this session of cyanosis.
بالنسبة للlevel الأبريسيشن or to saturation.
Yes.
يعني it is written in more than one text. But the level is 90 below 90.
طلع الفيزيولوجي